Ready?
Mm-hmm.
3, 2, 1.
Hello, Sarah. I'm Erica. I'm going to be taking care of you today. I'm going to wash my hands. I notice that you're dressed appropriately for the weather outside. You're smiling, nice and pleasant. I notice that your skin's pink, warm, and dry. I do notice a little freckle here. It's about less than 2 centimeters in diameter. No rough edges. It's smooth. I notice, if I got you smile for me, your smile facial is symmetrical. I'm going to have you close your eyes and tell me whether this is sharp or soft. 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 All right, good. Stephen, I'm going to have you open and close your jaw. Good. And then clench your teeth. Good muscle strength. I'm just going to feel your head. Notice you have brown hair. Hair is evenly distributed. Scalp is pink. Any tenderness? No tenderness. I don't notice any lumps or abrasions on your scalp. Then I'm going to take a look at your eyes. And so can you tell me whenever you can see my hands? Okay. And then follow my hand. Good. Okay. Now I'm just going to check your pupils. Good. Pupils are equal and reactive. Just going to shine this in the lighter light. Pupils are midline, no deviation. Your eyebrows are present. Hair is equally distributed. Eyelashes are evenly distributed. Your puncti are pink, conjunctiva pink. No drainage, moist. And I'm going to have you try to close your eyes. Good. Strength is good. And I'm going to have you take a look at your eye. Okay. Make sure it's okay. And so I'm going to shine this light in your eye for just a second. Okay. I see the optic disc and the red reflex. I follow. Among the optic discs are the retinal, the vessels, and the arteries. Everything looks good, no papilledema. Okay, now look at your ears. Notice that your ears are in a good position. Any pain or tenderness whenever I feel your ears. Good, I don't notice any drainage or anything on the outside. So I'm just going to check your hearing and tell me if you can hear this in both ears, okay? Okay, perfect. And then I'm going to check, put this on your mastoid process and check whether you can, sorry, tell me when you can't hear it. Okay, in here. Good, and that should be longer there. We do this on the other side. In here. Perfect. I'm going to check your lymph nodes. Preauricular, posterior auricular, occipital, tonsillar, submandibular, submental, supracervical, deep cervical, supraclavicular, and infraclavicular. Okay, and I'm just going to take a look at your nose. Any pain, tenderness? Don't notice any lumps, bumps, bruises. Take a look. I'm going to have you breathe in each side. This side. Good. I'm just going to look inside your nose. Good. Nice and clear, pink mucosa, a little bit of drainage in there. Otherwise, everything looks good. I'm actually going to do the whisper test for your hearing. I'm going to say 3 letters. A, B, C, and 3 numbers. 1, 2, 3. 1, 2, 3. Perfect. Okay, I'm going to check your sinuses. Any pain or tenderness? How about down here? Good. Okay, I'm gonna check here. Take a look at your mouth. Let's put this pen light. Okay, smile symmetrical, open up and say ah. I noticed that the soft palate rises, uvula's midline, teeth are intact, good hygiene, mucosa's pink, moist. You can stick your tongue out for me, move it from side to side, good muscular strength. I'll check the pharynx too. Tonsils are present, no exudate or drainage. I'm just going to grab your tongue for a second. From side to side, no masses. Good. Everything looks good there. All right, so I'm going to take a look at your ears. Now do this on both sides, and I'm going to do it on one side first. There's a little bit of wax present. I do notice the cone of light, the handle of Milius, and the short process. Tympanic membrane is intact. It's pearly gray. Looks good in there. So look at your neck, your trachea, it's midline. Feel for your thyroid gland, your isthmus. Any pain or tenderness there? Nope. Okay, I'm just going to go behind you. Feel this again. Any pain or tenderness? Good, no nodules present. And I would have you gag, but I noted that you have a gag reflex already. And so now I'm going to listen to you. So first I would notice that everything looks symmetrical. I'm going to check for tactile firmitus. Can you say 99?
99, 99, 99, 99.
Good, no tactile firmitus. I don't notice any tenderness, no nodules. I go ahead and listen. Deep breath, perfect. And go from side to side. No ladder motion. Perfect. Lung sounds are clear. Respiratory rate is regular. No wheezes. Coarse crackles heard. And then I'm going to go to the back. And so on back, I would notice, I'm going to check for tactile firmitus. Can you say 99?
99, 99, 99, 99.
Perfect. No tactile firmitus present. No nodules, Matt. Just any tenderness on your back. No. Listen. Deep breath in and out. 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 Good job. Okay, I'm just going to press on your back. Dullness should be resonant sounds. Okay, and then have you take a deep breath in and out. Good, good, symmetrical. Tell me if you feel any pain. I'm just going to tap on my hand. Any pain? No costovertebral angle tenderness. I'm going to check for your diaphragmatic excursion. So I have you take a deep breath in and deep breath out. assess that you have no jugular vein distension. I'm gonna have you look slightly to the left. And I'm gonna measure this. And it should be, it's less than 3 centimeters. Perfect. Now I'm gonna listen. First I'll listen with my diaphragm, the aortic, pulmonic, pars, tricuspid, mitral. And while I'm here, I would listen to the apical pulse for 1 minute. It's also known point of maximal impulse, and I would feel it's about 2 to 3 centimeters. And I would switch this around. Listen with my bell where you're still laying. Aortic, pulmonic, pars, tricuspid, mitral one. And then I just have you turn to your left a little bit. And we're going to listen to your mitral and your tricuspid valve again. Perfect. Do you mind sitting up for a minute, please? Okay, and I listen to your aortic and your pulmonic. And I assess no thrills, heaves, going on. Fingers. Neobuds are peeing, cap refills less than 2 seconds, no tinting, no edema. Noted. Check your pulses. Check your carotid. And your brachial. On each side, noting whether they were symmetrical. Pulses are 2+, radial. Okay, if you don't mind laying back, I'm just going to check your femoral. I'll go check both popliteals, dorsal pedis. And everything's 2+ equal. Okay, so now take a look at your abdomen. You have your shirt up.
You want to see my baby?
No. Your baby's not. Okay, I would note with your giraffe that you have no hernia, no abdominal masses noted, no lesions, no scars, and then I would listen, and I would listen to each quadrant for 1 minute. Notice that you have normal active bowel sounds. And I would percuss first. Percuss for your kidney. For its location. Noting any dullness. And check your spleen. And then over your bladder. Not only your dullness, you would have a full bladder. So I'm just going to lightly press on your belly. No nodules, tenderness, any pain? No? Okay. And then I'm just going to do a little bit harder. Any tenderness? Don't notice any masses. Then I'm going to, sorry, a little uncomfortable, check for your liver. Perfect. And then I'm going to check your spleen. Sorry, a little pushing. Over here, I'm going to check for this kidney, which are usually not palpable in this kidney. I think that's it on that one. So let's do range of motion. We sit up on the side. Okay, so first I would just assess all joints, muscles, making sure that there's no crepitus, any pain or tenderness, none. Okay, so first I'm going to do your shoulders. I'm gonna have you stick your arm out in front of you, and then lift it all the way up, and down, and all the way back. And then I'll have you adduct your arm, and then abduct your arm, and then cross it behind you, and then cross it in front of you. Perfect. And then I have you put your arm out to the side. Oops, sorry. And lift it up and down. Good. Good range of motion in your shoulder. I'm going to do both arms. And so with your hand, with your elbow, I'm just going to have you do it like you're doing a curl, then extend it, then put your hand like you're holding supinate it, pronate it. Good, good range of motion. And then we'll do your wrist. So I'll have you lay with your palms down and point your fingers down, and then point your fingers up, and in, and out, and then have both of your hands. I'm just gonna have squeeze your hands. Oh, perfect, equal. You're fine. And so then I'm gonna check for sensation. I'm gonna have a sharp object, or not sharp, but a paper clip and a cotton ball, and you tell me whether it's soft or sharp. Sorry, I'm just gonna kind of do it right here. Sharp. 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 It's hard, isn't it? Soft. Perfect. All right, so we did your shoulders, elbows, wrist, and then I'll have you stand up. And then you're fine. Bend forward. Good, and then kind of bend backward, and then kind of twist from side to side, and then lean from one side to the next. Perfect, and while we're up here, I'm just gonna have you walk across the room. Normal gait, arms swing freely, smooth turn, and I'm going to have you walk toe to heel. Perfect. Great. And then while you're standing, I'm just going to have you put your arms out in front of you and close your eyes. It's appropriate. Good. Arms rise on their own. And you can open up your eyes for a minute. I'm just going to take one hand, go ahead and close your eyes, and I'm going to put something in your hand, and if you can tell me what you think it is. A paper cup, okay? Now I'm going to draw a number in your hand, and you tell me what it is. A 3. Perfect. Okay, so now I'm going to have you sit down, and we're going to, first we'll do sitting and check your legs. I'm going to have you straighten your leg out and bend it, and then straighten it out again and cross it across your body and away from your body. Okay, and I'm just going to have you lay down. And then we're going to check for your hip. I'm going to have you bend your leg. Good, any pain or tenderness there. We're going to have you cross your body and then away from your body and then down. And I'm just going to take your leg, take it off and down. Any pain or tenderness there? No. Okay, and I'm going to have you sit back up on the side of the bed. We're going to check your neck range of motion. Can you put your chin to your chest? And then back. And then ear to shoulder and ear to shoulder. Good. And then it's from side to side. And we'll check the range of motion of your ankles. Okay, you push your toe up, point it, in and out, and then if you push your toe, good, nice strength. Any pain or tenderness whenever I do this? Okay. All right, now I'm going to check your reflexes. Just gonna have you put your arm out. Good. Do this one back here. Perfect. Good. And then your knee. Perfect. And we do those on both sides. Back of your foot. Perfect. And then for your abdomen, Check for any movements. Everything looks good there. Then I would have, I'm gonna put my finger here, and if you can take your finger from your nose to my finger. Okay, perfect. And have you do alternating mode movements? Looks good. Everything looks good. And then I'm going to check the bottom of your foot for your reflex. Your foot would curl down. Okay, I'm gonna move your foot back and forth, back and forth, back and